This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to Mon Health Live. We're taking you through the pandemic here with the information you need to know. We're pushing out as much information as we can here over the course of this health crisis. Hopefully it'll be over soon, but until it is, we're going to, again, provide you with the needed information here on these Saturday morning programs. David Goldberg is with us, and Dr. Atkinson's taking this weekend off. But David, thanks for joining us on Mon Health Live.
Happy New Year, and thanks for allowing me to be here again this week and us bringing news and events out to our community to keep them up to speed.
And we have a very special guest this morning. With us is West Virginia National Guard Major General James Hoyer, and obviously the National Guard, very important in terms of, I guess, early in this pandemic, getting the PPE out, and now it's all about the vaccine. And General Hoyer, thanks for joining us. We appreciate it.
Oh, absolutely. Glad to be with you.
All right, what's the latest information that you have? I'm just going to open this up to you right off the bat. What's the latest information you have that we need to know?
So obviously, as folks can see from the numbers, we are going, as is the rest of the country, through a surge, and we've got to continue to manage that. A lot of great work going on coordination-wise with the hospitals, through the Hospital Association, with long-term care facilities. We know that in the state of West Virginia, we've got to get at taking care of our aged population. We know that 77.5% of our deaths are people over the age of 70. And we've got to really get on that, stay on that. A lot of work continues to go on related to PPE and those things going forward. So we're managing it well as a state right now, but we as a state have to be prepared for continued surge over the next couple of months.
From what I understand from earlier in this week, all, or just about all, a very high percentage of long-term care facility residents and the staff members have been vaccinated, at least the first go-around with the vaccination, and that was accomplished in about half the time as originally thought. Is that correct?
Yes. So today we have 214 facilities that have been provided vaccine support. It looks like right now about 85% of the residents and about 65% of the staff have taken the vaccine. So today, as other states start the vaccination process under the federal program, West Virginia has administered its first dose to all 214 facilities.
That's really incredible. And what were some of the keys to getting that done that efficiently and that quickly?
So what we did early on is we stood up what we in the Guard and the state have used for a number of major events, what we in the military call a joint interagency task force. And that brings together not just the Guard folks from the Army and the Air Guard, but it's a partnership with DHHR, with the Hospital Association, the West Virginia Healthcare Association. It represents the long-term care and assisted living facilities, the retailers, and all those essential worker organizations, and bring everybody together and create a synchronized, coordinated effort to get at this. And clearly, we got a little bit of grief in the beginning from some major pharmacy chains saying, hey, wait, you need to go with this federal program. And we said, we're going to stay the course. And the governor allowed us to stay the course. And it clearly proved to be the right thing to do.
Yes, and that's the first dose. So the second dose comes when?
So for those who received the Pfizer vaccine, it's 21 days. So we're already preparing for those second doses to go out to those folks we got in that very first group that were Pfizer. The Moderna vaccine is 28 days, so we've got to manage that. The other thing we manage is Pfizer and Moderna are under two different environmental constructs. The Pfizer has that negative 80-degree temperature. The Moderna can go in a refrigerator or freezer. So the other really important group I really want to thank is the State Pharmacy Board, lady by the name of Krista Capehart, a pharmacist, lady from down in Huntington, Deb Keister, who works with the local health departments. She's a Marshall faculty member, and those folks have done some great coordination. We've got a lot of local pharmacies that are supporting this effort because there is a little bit of a trick to getting that dose out of the vial, making sure on the Pfizer vaccine it gets mixed with the appropriate saline and managed under temperature.
All right, I'm going to bring David in here in just one second, but one more question about the vaccine. Obviously, those second doses are, I guess, sitting, for lack of a better term. They're sitting somewhere. They're accounted for, right? So there's no danger of using up all the vaccine when people need that second dose that's coming, correct?
Correct. When we make the order to what is called Operation Warp Speed, the federal vaccine program, they automatically allocate a second dose with that. So there is an order process that we go through each week, and what we're doing now for this coming week is we're ordering initial doses for some and second doses for others. So a pretty complex process to manage. I tell folks this is probably the most significant logistics effort that I've seen in my almost 40 years of military service, to include, overseas logistics operations.
That's all incredible. David, you have anything for the general?
Well, first of all, he's the most humble man. I mean, his leadership, his steady hand, his access has been unbelievable. When we were short on PPE, he was the first person to jump in and said, David, what can we do for you? And that's here at Mon. He's done the same in the Guard and the governor and Clay Marsh, and the whole government has solidly been able to execute as flawless a plan as you've heard. Here at Mon, we've already vaccinated more than 678 so far and counting as we're through phase one. And the second vaccinations are starting the first week, coming into the next few days. Those who got the first shots, including our village at Heritage Point and all the providers associated with that.
General, where are we with PPE? Does everyone have everything they need? I know that's, I guess you probably never have every single thing you need, but is the state in good shape with PPE?
We think right now that we're in good shape, and as David pointed out, we're working cooperatively. What we did early on is the governor allowed us to stand up a separate task force, and we went out and procured PPE. We used some folks from WVU School of Business who do supply chain management to work with our logistics folks, and we have a surge supply of PPE. And as David said, we work cooperatively. When they might need something short term, we'll fill it, but we're also prepared to meet a surge going forward. The other thing that we're doing from a state perspective that I think is going to be really important going forward is we are developing the capability to make our own PPE for our West Virginia hospitals, our West Virginia healthcare facilities going forward. We can't rely on this overseas supply chain anymore, and the cost, the price gouging that's gone on, it's just been incredible.
Well, that's an incredible development. It really is. When we can manufacture what we need right here in the state of West Virginia, that's phenomenal.
Yeah, absolutely. We want, whether it's Mon General or Ruby or Princeton, to be able to either from West Virginia or from suppliers that are now developing capability in the United States to be able to get their own from here locally.
Mm-hmm.
And if I could jump in on that, the general shared some samples with me of reusable gowns and others. The quality is exceptional. So he's spot on. We can't rely on others when we can do it ourselves and have it at the ready for when we need it, rather than being beholden to others outside of West Virginia that might cause a shortage.
Sure, that's the way it should be. Absolutely, that's the way it should be. All right, General Hoyer, we appreciate your time. Anything else that you want to add or that needs to be out there?
No, I think it's just I want to thank David and his counterparts in the hospital association and the industry, and the Marty Wright and the folks from West Virginia Healthcare, who've just been absolute great partners. And because of that partnership, we have not encountered some of the challenges that our other states have. And I think continuing to work together will do great things, to include making our own PPE supply going forward.
Can you speak to real quick about future rollout of the vaccine? I know there's so many questions, and a lot of them just can't be answered at this point. But obviously, the first priority was were the older folks in the nursing homes, et cetera, medical personnel, first responders. Where are we with all of that, and in terms of when it might reach the general public?
So we're making good progress and continuing to, we got those long-term care facilities where 50% of our deaths have come from. We are doing, I think, as David pointed out, pretty good on our healthcare workers. That will continue to roll out. Essential workers over the age of 50, and we are going to make a real strong effort, you'll see here in the next couple of weeks, to get age 70 and above population in our state because of those numbers I gave you. If you go 60 and above, you're talking 92% of our loss of life has been in that age group. And as David can tell you, a significant portion of that age group makes up our hospitalization. So we'll go after those. I think the general public needs to be prepared to continue to stay socially distanced, masked, do all those things, because it's going to be late summer, early fall before we get large numbers of vaccines to get at the rest of the general public.
All right. Well, we are making progress, and that's incredible news. So a lot of great news today. General Hoyer, we appreciate your time again, and congratulations on your retirement, at least from this aspect of it.
Yeah, I'll be with David and the team, just in a different uniform.
Right. Very
and
good.
we are thrilled to be your continued partner, and thanks for your sacrifice and your families for leading us through this, General.
All right. Thank you, guys. Have a great day.
All right. Thanks, General James Hoyer there. David Goldberg with us, President and Chief Executive Officer of Mon Health Systems. We're going to take a break. We'll continue on with David on the program and continue the conversation. Stay with us. Mon Health Live continues on WAJR after this.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
And welcome back to Mon Health Live for the Saturday. Thanks for joining us. Dr. Atkinson taking the weekend off, but David Goldberg is with us, President, Chief Executive Officer of Mon Health System, and also with us we have Dr. Lisa Flower, Family Practice Doctor at Mon Health Primary Care in Fairmont. And Dr. Flower's with us. Thanks for coming on.
Thanks for having me.
We just heard from Major General Hoyer prior to that break about the statewide COVID-19 response efforts. Can you talk a little bit about what you're seeing locally, what you're seeing with the numbers locally, and your advice to people as we await the vaccine, what they need to continue to do?
We are locally seeing an increase in cases in the community. It's important for people to continue to wear their mask when they're out and about, continue to wash their hands, try to avoid gatherings of people, especially indoor gatherings. That would keep you the safest, to be quite honest, at this period of time and this surge that we're having.
Okay, so people are still, obviously this is incredibly contagious and people are still coming down with COVID-19. COVID-19? What should they do if they believe they need to see a doctor? Let's start with your facility in Fairmont. We'll bring David in. So I've got a temperature. I've got the COVID symptoms. What's my next step?
Contact your primary care doctor first and see where they want you to go and have a test done. Some facilities have them on site, such as our facility. We're taking care of our own patients. Other facilities may send you up to Mon General with an order up there to do a drive-through behind the hospital.
Okay. And David, the drive-through tests are still occurring on a daily basis at Mon General, correct?
Yeah, they are, and you need a physician order to Dr. Flower's point. So what we want to make sure is at our Fairmont office, our Gateway office or Westover and Sheet Lake, we're able to do the rapid test and the antigen test right then and there. If you have symptoms, they're tested. But again, it's flu season, GI bug season, respiratory season, which confuses people potentially. Do I or don't I have COVID? At the end of the day, if you're not feeling well, contact your doctor, and we'll navigate you to where we think is best for you to get the care you need.
Okay, speak with your doctor, get a doctor's order in terms of coming to get a COVID test. Dr. Flower, what about telehealth? What are the options there?
We're offering telehealth to all of our patients, honestly, even if you are just a diabetic or do a regular follow-up or have high blood pressure, and especially to those patients that do feel ill. We would do a telehealth visit and keep both of us safe and be able to assess your symptoms and properly help you to navigate the system as far as where you need to go after that visit.
Mm-hmm. All right, so we've gone through the process. We've done a telehealth appointment. We've contacted the doctor. We've had that COVID-19 test, and unfortunately, it's come back positive. Now what?
I recommend, if your doctor is not already aware, to let your doctor know, especially if you're an older adult or have medical complications. And if you're younger and just have the sniffles, it may not be a big deal. But if you have more serious symptoms, let your doctor know so that we can follow you. Again, we can do telehealth. We can let you know when it may be time to go to the emergency room or what symptoms to look out for.
Okay, so you mentioned the emergency room going on when someone needs to go to the ER. What's your advice there?
Well, mainly we're looking for difficulty breathing, or if their pulse oxygenation, their O2 sats are dropping too low. If they have a pulse ox at home and are able to monitor that, some people are getting dehydrated with this. And then we would recommend you let the emergency room, give them a phone call, let them know you're coming in with COVID so that they're prepared.
Mm-hmm. And David, with Mon Health in Morgantown, I know you've kind of put off some of the elective procedures, right? So the hospital is equipped to deal with a surge that we hopefully doesn't come, but still there's preparations being put in place, right?
Yeah, we've been doing a review of all of our elective cases for months now, and we've accelerated kind of reducing or asking patients who don't have life-threatening situations to defer some of their elective joints or screening colonoscopy and others a little longer because we want to make sure we have capacity in the hospital. Let me assure the public, Mon Health Medical Center has capacity. I'm sitting today across the system. We have 35, 40 COVID-positive patients, whether in an ICU bed or a med-surg bed. Mm-hmm. We only have across our system 29 providers or staff that are positive with COVID right now, of 3,500 employees. So we've been very careful. We screen all of our visitors, we screen our patients, and we screen our staff to make sure for signs or symptoms so we don't spread it and mitigate risk of spreading it inside to our providers providing care to our patients. So there's capacity. And to Dr. Flower, who spot on said, keep communication with your doctors, and if in doubt, go to the emergency room. We see you seamlessly. We've, of course, limited one visitor with a patient for consistency so we mitigate the spread to be able to make sure that we could see patients quickly, take care of them quickly, and reduce risk to those coming in, let alone those caring for patients.
And Dr. Flower, beyond COVID, it's still important to have, like you say, communication and contact with your primary care doctor. You need to continue to deal with other issues you may have as well.
Exactly. I mean, we're still seeing people having heart disease, having heart attacks, angina symptoms. It's the cold weather time. It's the holiday season where they get into too much salt and have issues, or again, COPD exacerbations. So those things, don't ignore your symptoms. Contact your doctor and see how best we can take care of you.
Mm-hmm. Did we see a post-Thanksgiving surge? And this question for both of you. We'll start with you, Dr. Flower. Did we see that post-Thanksgiving surge, and are we anticipating a post-Christmas surge?
For COVID, yes.
Yes. Okay.
We did see a post-Thanksgiving surge, and the Christmas surge, we'll know in the next week or two where we are. I guess,
David, it's a little bit too early to know for sure, but you want to believe, you want to hope that people did the right thing and just stayed with their immediate families, but it seems somewhat inevitable to have somewhat of a surge.
Yeah, there will be a surge, unfortunately. I think some people still heard it a little bit more than they should have, and if they did, they didn't always wear their mask or be socially distant. So we're preparing, unfortunately, for that increase or uptick. What I would say to those, and I got my vaccine, so I'll be the first to say it. I got shot 1, and we'll be getting shot 2 the first week as we enter into January. It is not 100% effective. You still have to mask and socially distance, even if you did get the vaccine. So it's wonderful to have. It gives us a sense of security, but it is not 100% effective because different strains are starting to spur around the country and around the nation, and especially the world. But we still have to be vigilant to mask, wash our hands, socially distance, and be cognizant going into the upper respiratory season that we become more vulnerable.
Mm-hmm. All right, guys, final minute of the program, and interesting you bring up having had the shot. Dr. Flower, have you had the first round of the vaccination?
I have had my first shot, and I'm anxiously awaiting getting my second next week.
Well, just speak to the people are worried about side effects or a little bit of arm pain or whatever. Dr. Flower, what was your experience?
Honestly, it was even less painful than a flu shot, and a flu shot is not very painful if you ask me. So my arm was very slightly sore that day, but that was it. I can't complain.
And David, I know you said the similar thing last week.
Yeah, same with me. It was a little pain in my arm for a day and a half like a flu shot, but other than that, no side effects whatsoever.
All right, so that's what we can tell you. If you have the opportunity to get this vaccine, do it. Don't worry about it. Get it done.
Absolutely.
Guys, great information today. We appreciate your time, and thanks for joining us.
Thank you.
All right, that's Mon Health Live for this Saturday, 104.5 FM, 1440 AM, WAJR.